I'm David Adams. It's my great pleasure to welcome you to the 5th ATS Mitral Conclave.
Hi, I'm Dr. Randy Martin, and I really am thrilled to be joined with Dr. Fred Mohr. Fred, good to see you.
Hi, Randy.
You've made tremendous contributions to the field of cardiology, cardiac surgery, and got a big honor yesterday at the conclave, so well deserved. Fred, you've been really through the history of the development of mitral valve treatments. How do you see where we are today and where we're going?
I mean, one has to look at it in two ways. In the last 20 years, the development of minimal invasive mitral valve repair surgery was, I think, the driving force, and it was very successfully done in several institutes, not in every institute.
Right.
And of course, those centers who did successfully perform minimal invasive mitral valve repairs, they had increasing numbers and 98% success rate of repairs, which is, I think, a great step forward, which also let the cardiologist and general physicians think this patient has a mitral insufficiency, he should have a repair. There was some resistance 20 years ago, or even 10 years ago, to send the patient for surgery because he got a replacement.
Right.
And that has changed. In general, I think the numbers will go further up. The people who perform the treatments, it may be minimal invasively. There is now, in the last 5 years, the add-on of catheter-based technique like the clip and the transseptal band, which is also very, very interesting. The clip has increasing numbers, but I think by echocardiography, especially by 3D echocardiography, you can very nicely define which will be the optimal treatment for every given patient. And we just saw these days here at the ATS perfect results of very complex repairs with different techniques. It is not really standardized. There are some standardized schools, but it has changed from the say Carpentier technique to use more neocords with different techniques. And I personally developed 15 years ago the loop technique with neocords, which is, especially if you go to India, for example, every surgeon uses it. And this has made the things easier and more reproducible.
Obviously, a lot of excitement in the transcatheter, the catheter-based treatments basically blew out of TAVR and then MitraClip success. How do you, but you're emphasizing really excellent outcomes. You're talking about good outcomes, good durability, but how do we, and there is a lot of excitement, but how do we maximize outcomes and versus just excitement to get into the transcatheter space? You understand what I'm saying?
Yeah.
Surgery has such proven track record.
Yeah, I think a controlled echocardiography control has to be done in every patient. And the clip procedure very often stays with residual MR. And from surgery we know that these patients don't do very well long term. So this has to be seen very critical. From the very beginning, I think one can define, even maybe in the future with, how you call it, intelligence.
Artificial intelligence, yeah, no doubt whatsoever.
To predict the outcome, if you do this or that, would be advantage.
No, it's a great point. I mean, there's tremendous I'm involved in some artificial intelligence looking at ultrasound, but there's some really interesting data on outcomes where you can feed all these variables in, and just like the some interesting things with that. Fred, you created a magnificent center, and I have been fortunate to go to the center, and actually got to go see Volkmar play in his band, which I used to play in your basement. But so tell our viewers and our colleagues that are listening, you built up a tremendous team concept. We hear about Heart Team, but you built this thing, and you really did have a team, and that's really critical to not only operative team, but nurses, OR, ICU. What's the secret for that?
I think the first thing is that you are not the superstar who can do everything. You have to accept that everybody needs support and need maybe even better than you are. I think the best option would be if you just had people who are better than yourself, and you accept that. And I had several of these people, like Volkmar, who was sitting downstairs, at Thomas, and so on. So I think it was very important from the very beginning that we had a very friendly friendship, let's say, and I supported them in their careers. And if you think about that, almost 25 surgeons had been educated and became chief out of Friedrich Heart Center and are all over the world. And
that's amazing.
I think this is, and everybody is a friend of everybody, which I think is the most important message. They all like each other. They played soccer together. Of course, they had the beer together, and myself as well. I think the team spirit is extremely important, and it is, of course, an advantage that we could start from the very beginning. So this was a startup, and in a startup you also always work closer together than in another situation. If you come in a running clinic and all of a sudden you come as a young boss and the other surgeons are older than you, it is very difficult to build up that spirit.
But I think you're making a key point, is that you basically created a level of excellence that was expected, but you created this collegial team and friendship thing. I mean, it's obvious when I saw the picture yesterday that David showed when you were on the stage of the, I guess when you quotes retired or so, of the you said 65 surgeons now, or 65 people in the group?
65 doctors in the surgical group.
That's amazing. That's absolutely amazing. Well, listen, you made great contributions, and I think we've all benefited from that. Most of all, the patients in Germany and elsewhere. So thank you so much.
I also have to thank all the American colleagues, especially my previous chief, Jack Mitral, who taught me economic ways of thinking and how to run it on an economic basis, which helped me a lot later on. He went through leadership courses, and I followed him to go through leadership courses, and I supported my young guys to go through leadership courses.
It's interesting. I heard you say that yesterday, and in American medicine, we really didn't think about the concepts of leadership, and there is a difference than what we grew up thinking, in business, because the business world has dealt with that. So I think that's really valuable. Well, again, thank you so much. Always enjoy seeing you.
Thank you very much.
Good. Thank you.
Hope next time we'll see each other in December in Leipzig.
I would love to do that. Thank you.
And we rock and roll again.
Thank you, and thank you for joining us.